Question 1. System analysis indicates a 42-year-old patient presence with heavy menstrual bleeding, pelvic pressure, and dysmenorrhea, which have been progressively worsening over the past year. A pelvic ultrasound reveals multiple intramural and submucosal uterine fibroids, with the largest measuring 6 cm. The patient expresses a strong desire to preserve her fertility. Considering the types of fibroids identified and the patient's symptoms and reproductive goals, which of the following management strategies best aligns with current best practices and ethical considerations for gynecologic care? Option A. Uterine artery embolization to shrink the fibroids, with a focus on symptom relief rather than fertility preservation. Option B. Surgical myomectomy to remove the fibroids while preserving the uterus, followed by discussion of medical management to reduce recurrence risk. Option C. Immediate hysterectomy to definitively resolve symptoms and prevent future fibroid growth. Option D. Prescribing oral contraceptives to manage heavy bleeding and pain, with a plan for repeat imaging in 6 months. The correct answer is B. Surgical myomectomy to remove the fibroids while preserving the uterus, followed by discussion of medical management to reduce recurrence risk. Explanation. Scenario analysis. This scenario presents a common clinical challenge involving a patient with symptomatic uterine fibroids. The professional challenge lies in accurately diagnosing the type and extent of fibroids, understanding their impact on the patient's reproductive health and quality of life, and then formulating a management plan that aligns with current best practices and patient preferences, all within the established regulatory framework for gynecologic care. The complexity arises from the variety of fibroid types, their diverse symptom presentations, and the range of available management options, each with its own risks, benefits, and indications. Correct approach analysis. The correct approach involves a comprehensive assessment that includes a detailed patient history, a thorough physical examination, and appropriate diagnostic imaging, such as ultrasound or MRI, to characterize the fibroids. This is followed by a discussion of all evidence-based management options, including watchful waiting, medical management, hormonal therapies, GnRH agonists, minimally invasive procedures, uterine artery embolization, myolysis, and surgical interventions, myomectomy, hysterectomy. The decision-making process must be patient-centered, respecting the patient's reproductive desires, symptom severity, and personal values. This aligns with the ethical principles of beneficence, non-maleficence, and patient autonomy, as well as regulatory guidelines that mandate informed consent and evidence-based practice in healthcare. Incorrect approaches analysis. One incorrect approach would be to immediately recommend hysterectomy without fully exploring less invasive or fertility-sparing options, especially if the patient expresses a desire for future fertility. This fails to uphold the principle of preserving reproductive potential when medically appropriate and may violate guidelines that advocate for a stepwise approach to treatment based on symptom severity and patient goals. Another incorrect approach would be to dismiss the patient's symptoms as minor or unrelated to the fibroids without adequate investigation. This could lead to delayed diagnosis and suboptimal management, potentially causing unnecessary suffering and impacting the patient's quality of life, which contravenes the ethical duty to provide diligent and thorough care. A third incorrect approach would be to offer only one treatment option without presenting alternatives or discussing the comparative risks and benefits. This undermines the principle of informed consent, as the patient is not given the full spectrum of choices necessary to make a truly autonomous decision about her care. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with accurate diagnosis. This involves gathering all relevant clinical data and utilizing appropriate diagnostic tools. Following diagnosis, a thorough discussion of all evidence-based treatment modalities should occur, tailored to the individual patient's specific fibroid characteristics, symptom profile, reproductive aspirations, and overall health status. Shared decision-making, where the patient is an active participant in her care plan, is paramount. This framework ensures that management is not only clinically sound, but also ethically compliant and patient-centered, adhering to all applicable regulatory standards for gynecologic practice. Question 2. Investigation of a patient presenting with persistent vaginal bleeding and elevated serum HCG levels following a molar pregnancy requires a multifaceted approach to accurately assess the risk and extent of potential gestational trophoblastic disease, Which of the following diagnostic strategies best aligns with established clinical guidelines for managing suspected GTD? Option A. Focus solely on managing the symptoms of bleeding with conservative measures and monitor HCG levels passively. Option B. Conduct a thorough pelvic ultrasound, obtain serial HCG measurements, and refer to a specialist center for further evaluation and management. Option C. Prescribe hormonal therapy to regulate the menstrual cycle and reevaluate in 6 months. Option D. Proceed with a diagnostic curettage and initiate chemotherapy based on the elevated HCG alone. Correct answer is D. Proceed with a diagnostic curettage and initiate chemotherapy based on the elevated HCG alone. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misdiagnosis and delayed treatment of gestational trophoblastic disease (GTD), a spectrum of placental-related tumors. The critical need for accurate staging and risk assessment is paramount for effective management and to prevent potentially life-threatening complications such as metastases. The professional challenge lies in integrating diagnostic findings with established clinical guidelines and ensuring appropriate follow-up, especially when initial presentations can be ambiguous. Correct approach analysis. The correct approach involves a comprehensive assessment that includes detailed patient history, thorough physical examination, and appropriate diagnostic imaging, such as ultrasound, to evaluate the extent of the disease. Crucially, it necessitates the measurement of serum human chorionic gonadotropin, HCG levels, which are a key biomarker for GTD. Following established diagnostic protocols for GTD, such as those outlined by relevant professional bodies e.g. Royal College of Obstetricians and Gynecologists in the UK or ACOG in the US, depending on the specified jurisdiction for this exam, is essential. This includes prompt referral to a specialist center for further management and monitoring, which is a cornerstone of best professional practice in GTD care. Adherence to these protocols ensures timely and accurate diagnosis, appropriate risk stratification, and the initiation of evidence-based treatment, thereby optimizing patient outcomes and minimizing morbidity and mortality. Incorrect approach is analysis. One incorrect approach would be to rely solely on a single diagnostic modality, such as ultrasound, without correlating findings with HCG levels. This is a regulatory and ethical failure because it bypasses a critical diagnostic marker for GTD, potentially leading to underdiagnosis or misdiagnosis. Another incorrect approach is to delay referral to a specialist center, attempting to manage the condition without the necessary expertise and resources. This constitutes a failure to adhere to best practice guidelines, which mandate specialist management for GTD and could result in suboptimal treatment and increased risk to the patient. A third incorrect approach is to dismiss symptoms as benign without a thorough investigation, especially in the presence of risk factors. This represents a failure in clinical diligence and adherence to diagnostic pathways, potentially leading to delayed diagnosis and progression of the disease, which is a significant ethical and professional lapse. Professional reasoning. Professionals should approach suspected GTD with a systematic and evidence-based methodology. This involves a high index of suspicion, particularly in women with relevant risk factors or concerning symptoms. The decision-making process should prioritize a comprehensive diagnostic workup, including the integration of clinical presentation, imaging, and biochemical markers. Prompt consultation with or referral to a specialist center experienced in managing GTD is a non-negotiable step. Professionals must remain current with the latest guidelines and protocols for GTD diagnosis and management to ensure they are providing the highest standard of care. Question 3. What factors determine the optimal surgical approach and potential intraoperative challenges when performing a vaginal hysterectomy, considering the inherent structural and functional characteristics of the female reproductive tract and surrounding pelvic anatomy? Option A. The patient's menstrual cycle phase and the presence of any recent vaginal discharge. Option B. The patient's body mass index and the presence of any pre-existing skin conditions on the vulva. Option C. The surgeon's preferred surgical instrument set and the availability of specific suture materials. Option D. The degree of vaginal laxity, the presence and extent of pelvic organ prolapse, the depth and width of the vaginal vault, and the integrity of the uterosacral and cardinal ligaments. The correct answer is D. The degree of vaginal laxity, the presence and extent of pelvic organ prolapse, the depth and width of the vaginal vault, and the integrity of the uterosacral and cardinal ligaments. Explanation: this scenario is professionally challenging because it requires a clinician to integrate complex anatomical knowledge with patient-specific factors to ensure optimal surgical outcomes and patient safety. The integrity and function of vaginal structures are paramount during gynecologic procedures, and deviations from normal anatomy or physiology can significantly impact surgical planning and execution. Careful judgment is required to anticipate and manage potential complications arising from variations in vaginal wall thickness, elasticity, depth, and the presence of underlying structures like the bladder, rectum, and pelvic floor musculature. The correct approach represents best professional practice because it prioritizes a thorough preoperative assessment that includes a detailed patient history, physical examination, and potentially imaging. This comprehensive evaluation allows for the identification of any anatomical variations or pathological conditions that could affect the surgical field. Adherence to established surgical protocols and guidelines, coupled with intraoperative vigilance and adaptability, ensures that the procedure is performed safely and effectively, minimizing risks of injury to surrounding organs and optimizing functional recovery. This aligns with the ethical principles of beneficence and non-maleficence, as well as regulatory requirements for competent medical practice. An incorrect approach that relies solely on a standard surgical approach without considering individual patient anatomy would be a significant regulatory and ethical failure. This could lead to inadvertent injury to adjacent organs, e.g., bladder or rectal perforation, excessive bleeding, or compromised surgical outcomes, violating the principle of non-maleficence. Failing to adequately assess vaginal elasticity or depth could result in inadequate surgical margins or difficulty in achieving the desired surgical objective, impacting the principle of beneficence. Furthermore, not adapting the surgical technique based on intraoperative findings, such as unexpected adhesions or tissue friability, would demonstrate a lack of professional judgment and potentially violate standards of care. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive patient assessment, including a detailed history and physical examination focusing on relevant gynecologic and obstetric history. 2. Consideration of preoperative imaging, if indicated by patient history or suspected pathology. 3. Development of a tailored surgical plan that accounts for anticipated anatomical variations. 4. Intraoperative assessment and adaptation of the surgical technique based on real-time findings. 5. Continuous intraoperative monitoring for potential complications and prompt management. 6. Postoperative care focused on recovery and monitoring for complications. This iterative process ensures patient safety and optimal outcomes. Question 4. When evaluating a postmenopausal patient presenting with a newly discovered ovarian cyst on ultrasound, what is the most appropriate initial step to accurately classify the cyst and determine the subsequent management strategy? Option A. Advise the patient to wait and reevaluate the cyst in 6 months without further immediate investigation. Option B. Perform a transvaginal ultrasound and apply standardized criteria, such as the International Ovarian Tumor Analysis, IOTA, simple rules, or calculate a risk of malignancy index, RMI, in conjunction with patient's clinical factors. Option C. Immediately schedule surgical removal of the cyst based on its size, regardless of its sonographic characteristics. Option D. Rely solely on the CA-125 tumor marker level to decide whether the cyst is benign or malignant. The correct answer is B. Perform a transvaginal ultrasound and apply standardized criteria, such as the International Ovarian Tumor Analysis, IOTA simple rules, or calculate a risk of malignancy index, RMI, in conjunction with patient's clinical factors. Explanation: scenario analysis. This scenario presents a common clinical challenge in gynecology, differentiating between benign and potentially malignant ovarian cysts. The professional challenge lies in accurately classifying the cyst based on imaging characteristics and clinical presentation to guide appropriate management, avoiding both overtreatment of benign conditions and undertreatment of malignant ones. This requires a thorough understanding of cyst morphology, patient risk factors, and current diagnostic guidelines. Correct approach analysis. The correct approach involves a comprehensive evaluation that integrates imaging findings with clinical context. This aligns with best professional practice as dictated by gynecologic guidelines, which emphasize a multifaceted diagnostic strategy. Specifically, utilizing the International Ovarian Tumor Analysis, IOTA, Simple Rules or Risk of Malignancy Index, RMI for ultrasound assessment, alongside patient age, menopausal status, and tumor markers, like CA 125, though its role is nuanced and often used in conjunction with other factors, provides a structured framework for risk stratification. This systematic approach minimizes subjective interpretation and ensures that management decisions are evidence-based, thereby adhering to ethical principles of beneficence and non-maleficence by optimizing patient outcomes and minimizing unnecessary interventions. Incorrect approach is analysis, relying solely on a single imaging characteristic, such as size, without considering other morphological features, e.g., presence of septations, solid components, papillary projections, or clinical factors, is a significant regulatory and ethical failure. This approach risks misclassification, potentially leading to unnecessary surgical intervention for a simple cyst or delayed diagnosis of a malignancy. Similarly, basing management decisions solely on tumor marker levels without correlating them with imaging and clinical presentation is problematic. Tumor markers can be elevated in benign conditions and normal in some malignancies, making them unreliable as standalone diagnostic tools. This failure to integrate information violates the principle of thoroughness in diagnosis and can lead to suboptimal patient care. Furthermore, proceeding with surgical intervention based on a presumptive diagnosis without adequate preoperative risk stratification or consideration of less invasive diagnostic steps where appropriate represents a failure to adhere to established clinical pathways and can be considered an overreach of medical necessity, potentially causing iatrogenic harm. Professional reasoning. Professionals should adopt a systematic, evidence-based approach to ovarian cyst evaluation. This involves 1. Obtaining a detailed patient history including age, menopausal status, and symptoms. 2. Performing a thorough pelvic examination. 3. Conducting a transvaginal ultrasound to assess cyst morphology using standardized criteria, e.g., IOTA simple rules. 4. Considering relevant tumor markers in the context of imaging and clinical findings. And 5. Stratifying the risk of malignancy to guide the subsequent management plan, which may range from watchful waiting to surgical intervention. This iterative process ensures that decisions are informed, patient-centered, and aligned with current best practices and regulatory expectations for gynecologic care. Question 5. The audit findings indicate a need to review the standard operating procedures for the initial assessment of couples presenting with infertility. Which of the following approaches best aligns with current regulatory frameworks and best practices for gynecologic care in this context? Option A. Initiate a detailed medical history and physical examination for both partners, followed by baseline hormonal assessments and semen analysis, before considering further specialized investigations. Option B. Focus solely on the female partner's reproductive history and symptoms, deferring any evaluation of the male partner until the female partner's workup is complete. Option C. Recommend empirical treatment with ovulation induction agents without a prior comprehensive evaluation of both partners' reproductive health. Option D. Immediately proceed with advanced imaging techniques such as hysterosalpingography or diagnostic laparoscopy for the female partner based on the duration of attempted conception. The correct answer is A. Initiate a detailed medical history and physical examination for both partners, followed by baseline hormonal assessments and semen analysis, before considering further specialized investigations. Explanation. This scenario presents a professional challenge due to the inherent complexity of infertility evaluation and treatment, which often involves sensitive patient information, evolving medical knowledge, and significant emotional impact on individuals and couples. The need for careful judgment arises from balancing patient autonomy, the physician's duty of care, and adherence to established clinical guidelines and regulatory frameworks governing healthcare provision and data privacy. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based evaluation tailored to the individual patient's circumstances. This aligns with regulatory requirements for quality patient care, informed consent, and appropriate use of medical resources. Specifically, It adheres to principles of patient-centered care, ensuring that diagnostic and therapeutic decisions are made collaboratively with the patient, respecting their values and preferences. This approach also implicitly follows guidelines that mandate accurate record-keeping and adherence to established diagnostic pathways, minimizing unnecessary interventions and associated risks. An incorrect approach that focuses solely on a single diagnostic test without a thorough initial assessment would fail to meet regulatory standards for comprehensive care. It could lead to misdiagnosis, delayed appropriate treatment, and potential patient harm, violating the physician's duty of care. Furthermore, it might not adequately address the multifaceted causes of infertility, which can stem from both male and female factors, or even be unexplained, necessitating a broader investigative scope. Another incorrect approach that prematurely recommends aggressive or experimental treatments without exhausting standard diagnostic and therapeutic options would be ethically and regulatorily problematic. This could expose patients to undue risks, significant financial burdens, and emotional distress without a clear indication or sufficient evidence of efficacy. It would also likely contravene guidelines on responsible resource utilization and the ethical principles of beneficence and non-maleficence. A third incorrect approach that relies on anecdotal evidence or unverified treatment modalities would be a direct violation of regulatory requirements for evidence-based medicine and professional conduct. Such practices undermine patient safety and trust, and could lead to disciplinary action. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the patient's history and concerns. Second, applying current, evidence-based clinical guidelines for infertility evaluation. Third, engaging in shared decision-making with the patient, explaining all diagnostic and treatment options, their risks, benefits, and alternatives. And fourth, documenting all assessment, discussion, and decisions meticulously. This ensures that care is both medically sound and ethically compliant, respecting patient autonomy and regulatory mandates. Question 6. Compliance review shows a 22-year-old female presenting with lower abdominal pain, fever, and vaginal discharge. Her medical history includes a diagnosis of chlamydia 3 months ago and gonorrhea 6 months ago. She reports unprotected sexual intercourse with a new partner in the last month. She denies any recent urinary symptoms or gastrointestinal complaints. A urine pregnancy test is negative. Based on current U.S. regulatory and professional guidelines for managing pelvic inflammatory disease (PID), which of the following is the most appropriate initial management strategy? Option A. Perform a pelvic ultrasound to rule out other causes of abdominal pain before initiating any treatment for suspected PID. Option B. Discharge the patient with instructions for symptomatic relief and recommend a follow-up appointment in 2 weeks if symptoms persist. Option C. Prescribe a single oral antibiotic with coverage for common vaginal flora and advise the patient to return if symptoms worsen. Option D. Initiate empiric broad-spectrum antibiotic therapy covering *Chlamydia trachomatis *, Neisseria gonorrhoeae *, and anaerobic bacteria, and arrange for follow-up within 48-72 hours. Correct answer is C. Prescribe a single oral antibiotic with coverage for common vaginal flora and advise the patient to return if symptoms worsen. Explanation. Scenario analysis. This scenario presents a common clinical challenge in gynecology, diagnosing and managing pelvic inflammatory disease (PID) in a patient with a history of sexually transmitted infections (STI). The professional challenge lies in balancing the urgency of prompt treatment to prevent long-term complications like infertility and chronic pelvic pain with the need for accurate diagnosis, especially when symptoms can be vague or mimic other conditions. The patient's history of STIs significantly increases her risk, necessitating a high index of suspicion and adherence to established diagnostic and treatment protocols. Correct approach analysis. The correct approach involves a comprehensive assessment that includes a detailed history, physical examination, and appropriate laboratory investigation to confirm the diagnosis and identify causative organisms. This aligns with best professional practice as outlined by specify relevant U.S. regulatory body, e.g., CDC guidelines for the management of pelvic inflammatory disease and specify relevant U.S. Medical Association guidelines, e.g., ACOG Practice Bulletin on Pelvic Inflammatory Disease. Prompt initiation of broad-spectrum antibiotic therapy covering common pathogens, e.g. Chlamydia trachomatis Neisseria gonorrhoeae and anaerobic bacteria, is crucial to prevent further damage and complications. This approach prioritizes patient safety and adherence to evidence-based medicine, minimizing the risk of sequelae. Incorrect approach is analysis. One incorrect approach would be to delay treatment based solely on a negative urine pregnancy test, assuming that PID is unlikely in the absence of pregnancy. This is a significant regulatory and ethical failure because PID can occur independently of pregnancy, and delaying treatment can lead to severe complications. Furthermore, it demonstrates a lack of understanding of the pathophysiology and risk factors for PID. Another incorrect approach would be to prescribe a single antibiotic agent that does not provide broad-spectrum coverage for the most common causative organisms. This is a failure to adhere to established treatment guidelines and can result in treatment failure, leading to persistent infection and increased risk of complications. It also fails to adequately address the potential for polymicrobial infection. A third incorrect approach would be to discharge the patient without initiating treatment, advising her to return only if symptoms worsen significantly. This is a critical failure in patient care and a violation of the professional duty to provide timely and appropriate medical intervention. It exposes the patient to undue risk of serious, irreversible damage and potential infertility. Professional reasoning. Professionals should approach such cases by first activating a systematic diagnostic and management framework. This involves 1. Thoroughly gathering patient history, including sexual history and past STIs. 2. Forming a comprehensive physical examination, including a pelvic exam to assess for cervical motion tenderness, uterine tenderness, and adnexal tenderness. 3. Ordering appropriate diagnostic tests, such as a nucleic acid amplification test, NOT, for Chlamydia trachomatis and Neisseria gonorrhoeae a wet mount for Trichomonas vaginalis and bacterial vaginosis, and potentially a urine pregnancy test and urinalysis. 4. Initiating empiric broad-spectrum antibiotic therapy based on clinical suspicion and local resistance patterns, as per current guidelines, while awaiting definitive test results. 5. Providing clear patient education regarding the importance of treatment adherence, partner notification and treatment, and follow-up care. Question 7. Cost-benefit analysis shows that for a patient diagnosed with stage III epithelial ovarian cancer, a combination of aggressive surgical debulking, followed by platinum-based chemotherapy, offers the highest probability of long-term survival and disease control. However, the patient is elderly with significant comorbidities and expresses a strong preference to avoid major surgery if possible, prioritizing quality of life in the short term. Considering these factors and the available treatment modalities, which approach best balances efficacy, patient well-being, and adherence to professional standards. Option A. Proceed with neoadjuvant chemotherapy to downstage the tumor, followed by reassessment for interval debulking surgery and adjuvant chemotherapy, while carefully managing her comorbidities and discussing her quality of life preferences throughout the treatment course. Option B. Initiate a course of combination chemotherapy without any surgical intervention, as this addresses the systemic nature of the disease and avoids the immediate risks of surgery. Option C. Advise against any active treatment, focusing solely on supportive care, given her age, comorbidities, and expressed preference to avoid aggressive interventions. Option D. Recommend palliative radiation therapy to the pelvic region to manage potential symptoms, as this avoids major surgery and aligns with her preference for less invasive treatment. The correct answer is A. Proceed with neoadjuvant chemotherapy to downstage the tumor, followed by reassessment for interval debulking surgery and adjuvant chemotherapy, while carefully managing her comorbidities and discussing her quality of life preferences throughout the treatment course. Explanation. Scenario analysis. This scenario presents a common and complex challenge in gynecologic oncology, balancing the potential benefits and harms of different treatment modalities for a patient with a newly diagnosed, advanced-stage ovarian cancer. The challenge lies in integrating patient-specific factors, age, comorbidities, performance status, patient preferences, with the evidence-based efficacy and toxicity profiles of surgery, chemotherapy, and radiation therapy, all within the context of regulatory guidelines for cancer treatment and patient care. The cost-benefit aspect, while not purely financial in this context, refers to the trade-off between treatment effectiveness, potential side effects, impact on quality of life, and long-term outcomes. Correct approach analysis. The optimal approach involves a multidisciplinary team discussion and shared decision-making with the patient. For advanced ovarian cancer, the standard of care often involves primary site-reductive surgery followed by platinum-based chemotherapy. Radiation therapy may be considered in specific palliative situations or as part of adjuvant treatment in select cases, but it is not typically the primary curative modality for advanced epithelial ovarian cancer. A comprehensive assessment of the patient's overall health, the extent and location of the disease, and her personal values and goals is paramount. This aligns with regulatory frameworks that emphasize patient-centered care, evidence-based medicine, and the principle of beneficence and non-maleficence. The decision to proceed with surgery, chemotherapy, or a combination requires careful consideration of the potential for cure or significant palliation versus the risks of morbidity and mortality associated with each intervention. Incorrect approaches analysis. Choosing surgery alone without considering the systemic nature of advanced ovarian cancer would be an incomplete approach, potentially leaving microscopic disease behind and leading to recurrence. This fails to adhere to best practices for managing advanced malignancies. Recommending radiation therapy as the primary curative treatment for advanced epithelial ovarian cancer, without a clear indication for palliative symptom control or specific adjuvant use, would be a significant deviation from established oncologic principles and regulatory guidelines for evidence-based cancer treatment. This approach risks exposing the patient to ineffective treatment with potential toxicity. Initiating chemotherapy without a thorough pre-treatment evaluation, including surgical staging and assessment of resectability, would be premature and potentially suboptimal. It might also overlook opportunities for maximal tumor debulking, which is a critical prognostic factor in ovarian cancer. This disregards the established sequence of care and the importance of accurate staging. Professional reasoning. Professionals must adopt a systematic approach that begins with accurate diagnosis and staging. This is followed by a thorough evaluation of the patient's overall health status and preferences. Treatment decisions should be guided by evidence-based guidelines, often developed by professional oncology societies and endorsed by regulatory bodies. A multidisciplinary team, including gynecologic oncologists, medical oncologists, radiation oncologists, pathologists, radiologists, and nurses, should collaborate to formulate a treatment plan. Crucially, shared decision-making with the patient, ensuring she understands the risks, benefits, and alternatives of each treatment option, is an ethical and regulatory imperative. This process ensures that the chosen modality or combination of modalities offers the best chance of achieving the desired outcome while minimizing harm and respecting patient autonomy. Question 8. The risk matrix shows a potential for significant treatment-related toxicity in patients with advanced gynecologic malignancies undergoing aggressive chemotherapy. Considering the evolving understanding of palliative care's role throughout the disease trajectory, which of the following approaches best reflects current best practices and ethical considerations for managing such patients? Option A. Integrate palliative care services early in the treatment plan to proactively manage symptoms and support the patient's quality of life, alongside ongoing oncological treatment. Option B. Assume that palliative care signifies a withdrawal of active cancer treatment and only introduce it when all other treatment options have been exhausted. Option C. Defer formal palliative care consultation until the patient is no longer responding to curative treatments or is nearing the end of life. Option D. Focus exclusively on maximizing the dosage and duration of chemotherapy to achieve the best possible oncological outcome, with symptom management addressed only if it becomes critically severe. The correct answer is A. Integrate palliative care services early in the treatment plan to proactively manage symptoms and support the patient's quality of life, alongside ongoing oncological treatment. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of balancing aggressive oncological treatment with the patient's quality of life and symptom management in advanced gynecologic cancer. The risk matrix highlights potential conflicts between achieving disease control and ensuring patient comfort and dignity, particularly when treatment toxicity becomes significant. The physician must navigate patient autonomy, family involvement, and the evolving understanding of palliative care's role not just at the end of life, but as an integral part of care throughout the disease trajectory. Correct approach analysis. The correct approach emphasizes a multidisciplinary, patient-centered strategy that integrates palliative care early and continuously. This aligns with current best practices and ethical guidelines in oncology, which advocate for symptom management and psychosocial support from diagnosis onwards. In the context of gynecologic oncology, this means proactively addressing pain, nausea, fatigue, and emotional distress, which are common side effects of treatment and symptoms of the disease itself. This approach respects patient autonomy by ensuring informed decision-making about treatment goals, which may shift from curative intent to symptom relief and improved quality of life as the disease progresses. It also fosters open communication among the patient, family, and care team, promoting a shared understanding of goals and expectations. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as aggressive treatments that cause significant suffering without clear benefit may be reconsidered in favor of palliative interventions. Incorrect approaches analysis. One incorrect approach involves delaying the formal integration of palliative care until the patient is nearing the end of life or has exhausted all curative treatment options. This is a significant regulatory and ethical failure because it contravenes the principle of early palliative care integration, which is now a standard of care. It can lead to prolonged suffering, uncontrolled symptoms, and a reactive rather than proactive approach to patient well-being. Patients may experience unnecessary pain and distress, and their wishes regarding care goals may not be adequately understood or honored. Another incorrect approach is to solely focus on disease-modifying treatments without adequately assessing or managing treatment-related toxicities and symptom burden. This can result in a patient experiencing severe side effects that significantly impair their quality of life, potentially leading to treatment cessation due to toxicity rather than a shared decision based on evolving goals of care. Ethically, this approach risks violating the principle of non-maleficence by causing undue harm. A third incorrect approach is to assume that palliative care is synonymous with giving up on the patient or solely focusing on hospice. This misunderstanding can lead to a reluctance to involve palliative care specialists, thereby missing opportunities to optimize symptom control and psychosocial support. Palliative care is an active, ongoing component of care that can be delivered alongside active cancer treatment, and its scope extends far beyond end-of-life care. Professional reasoning. Professionals should adopt a proactive and integrated approach to palliative care in gynecologic oncology. This involves 1. Early assessment. Routinely assess for pain, symptom burden, and psychosocial distress from the time of diagnosis. 2. Multidisciplinary collaboration. Engage palliative care specialists, nurses, social workers, and other allied health professionals early in the care plan. 3. Shared decision-making. Facilitate open and honest conversations with patients and their families about treatment goals, potential benefits, and risks, including the impact on quality of life. 4. Symptom management. Prioritize aggressive and effective management of pain, nausea, fatigue, and other symptoms. 5. Goal reevaluation. Regularly reevaluate treatment goals as the disease progresses and the patient's condition changes, ensuring alignment with the patient's values and preferences. 6. Communication. Maintain clear and consistent communication among all members of the care team and with the patient and family. Question 9. Strategic planning requires a comprehensive understanding of a patient's presenting symptoms, potential underlying pathologies, and individual life goals when formulating a management strategy for a chronic gynecologic condition. Considering a patient presenting with dysmenorrhea, dyspareunia, and pelvic pain, which of the following diagnostic and therapeutic approaches best reflects a proactive and patient-centered strategy for endometriosis? Option A. Initiate empirical hormonal therapy to suppress ovulation and alleviate symptoms, deferring further investigation until symptoms fail to respond. Option B. Prescribe escalating doses of non-steroidal anti-inflammatory drugs, NSAID, and analgesics as the primary treatment, with surgical intervention considered only as a last resort for intractable pain. Option C. Proceed directly to laparoscopic excision of all visible endometriotic implants based on imaging findings suggestive of deep infiltrating endometriosis, without further discussion of fertility or alternative treatments. Option D. Conduct a thorough diagnostic workup including imaging, and if indicated, laparoscopy for definitive diagnosis, followed by a shared decision-making process to select a treatment plan that addresses symptom control, disease management, and the patient's reproductive desires. The correct answer is A. Initiate empirical hormonal therapy to suppress ovulation and alleviate symptoms, deferring further investigation until symptoms fail to respond. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinician to balance the immediate need for symptom relief with the long-term implications of treatment choices for a chronic condition like endometriosis. The patient's desire for rapid symptom improvement must be weighed against potential side effects, fertility considerations, and the evolving understanding of endometriosis management. This necessitates a thorough understanding of the pathophysiology, diagnostic nuances, and a range of treatment options, from medical to surgical, each with its own risk-benefit profile. Correct approach analysis. The correct approach prioritizes a comprehensive diagnostic workup and a shared decision-making process with the patient. This aligns with best professional practice by ensuring that treatment is tailored to the individual's specific disease presentation, symptom severity, and personal goals, including fertility desires. Adhering to established clinical guidelines for endometriosis diagnosis and management, which emphasize a stepwise approach and patient-centered care, is paramount. This ensures that interventions are evidence-based and ethically sound, respecting patient autonomy and promoting optimal outcomes. Incorrect approaches analysis. One incorrect approach involves immediately resorting to hormonal suppression without a definitive diagnosis or thorough discussion of alternatives. This fails to acknowledge the diagnostic complexities of endometriosis, where imaging alone is often insufficient and surgical confirmation may be necessary. Ethically, it bypasses the informed consent process by not fully exploring the patient's understanding and preferences. Another incorrect approach is to solely focus on pain management with analgesics without investigating the underlying pathology or considering treatments that address the disease itself. This neglects the chronic and progressive nature of endometriosis and may lead to delayed or inadequate treatment, potentially worsening the condition and impacting quality of life. It also fails to meet the professional standard of care for a condition requiring specific therapeutic interventions. A third incorrect approach is to recommend aggressive surgical intervention as the first line of treatment for all cases, irrespective of symptom severity or patient desire for future fertility. While surgery can be curative in some instances, it carries significant risks and may impact fertility. This approach fails to consider less invasive options and the patient's reproductive goals, violating the principle of proportionality in treatment. Professional reasoning. Professionals should approach such cases by first establishing a clear diagnosis through a combination of detailed history, physical examination, and appropriate imaging. Subsequently, a thorough discussion with the patient about the pathophysiology of endometriosis, the diagnostic limitations, and the spectrum of treatment options, medical, surgical, and conservative, is essential. This discussion should explicitly address the patient's symptom burden, impact on quality of life, fertility aspirations, and potential risks and benefits of each treatment modality. Shared decision-making, where the patient actively participates in choosing the most suitable treatment plan, is the cornerstone of ethical and effective care. Question 10. Stakeholder feedback indicates a need to reinforce the foundational anatomical knowledge critical for gynecologic practitioners. When evaluating a patient presenting with suspected pelvic inflammatory disease and potential tubal involvement, which of the following descriptions most accurately reflects the key anatomical features of the fallopian tubes relevant to diagnosis and management? Option A. The fallopian tubes are complex, tortuous structures with distinct anatomical segments, isthmus, ampulla, infundibulum with fimbriae, that are intimately related to the ovarian vascular supply and peritoneal cavity. Option B. The fallopian tubes are short, rigid tubes that attach directly to the posterior aspect of the uterus, with no significant peritoneal lining. Option C. The fallopian tubes are simple, straight conduits extending from the uterus to the ovaries, with a consistent lumen size throughout their length. Option D. The fallopian tubes are primarily muscular organs responsible for egg transport, with minimal surrounding connective tissue or vascularization. The correct answer is C. The fallopian tubes are simple, straight conduits extending from the uterus to the ovaries, with a consistent lumen size throughout their length. Explanation. This scenario is professionally challenging because it requires a clinician to synthesize complex anatomical knowledge with the practical implications for patient care, specifically in the context of gynecologic procedures. The fallopian tubes, while seemingly straightforward in their anatomy, possess intricate structures and relationships that directly impact surgical outcomes, fertility preservation, and the diagnosis of various pathologies. Misunderstanding or misapplying this anatomical knowledge can lead to significant patient harm, including iatrogenic injury, compromised fertility, or delayed diagnosis. Careful judgment is required to select the most appropriate diagnostic or therapeutic approach based on a precise understanding of tubal anatomy and its variations. The correct approach represents best professional practice because it demonstrates a thorough and accurate understanding of the anatomy of the fallopian tubes, specifically their relationship to surrounding pelvic structures and their role in reproductive function. This precision is paramount in gynecologic practice, where interventions often occur in close proximity to vital organs. Adherence to established anatomical knowledge ensures that diagnostic and therapeutic decisions are evidence-based and minimize risks. This aligns with the ethical principles of beneficence and non-maleficence, as well as professional standards of care that mandate competence in anatomical knowledge for safe and effective patient management. An incorrect approach that relies on generalized or incomplete anatomical understanding is professionally unacceptable. For instance, assuming a uniform diameter or length of the fallopian tubes without considering individual variation can lead to misinterpretation of imaging studies or inappropriate surgical planning. This could result in overlooking ectopic pregnancies, misdiagnosing hydrosalpinx, or causing damage during procedures like tubal ligation or salpingectomy. Such errors violate the duty of care owed to the patient and fall short of the expected standard of competence. Furthermore, if a specific regulatory framework for gynecologic practice mandates a certain level of anatomical knowledge for credentialing or continuing education, failure to meet this standard could also constitute a regulatory violation. The professional decision-making process for similar situations should involve a systematic approach. First, a comprehensive review of the patient's clinical presentation and relevant diagnostic findings is essential. Second, the clinician must access and apply accurate, up-to-date anatomical knowledge specific to the pelvic region, including the fallopian tubes, their mesosalpinx, and their relationship to the ovaries, uterus, and pelvic vasculature. Third, the clinician should consider potential anatomical variations and their implications for the planned intervention or diagnostic interpretation. Finally, the decision should be documented clearly, reflecting the anatomical rationale behind the chosen course of action. This structured approach ensures that decisions are informed, evidence-based, and patient-centered, minimizing the risk of error and promoting optimal patient outcomes. Question 11. Governance review demonstrates a consistent pattern of discrepancies in the initial assessment of advanced ovarian cancer cases, leading to potential delays in appropriate adjuvant therapy. A multidisciplinary tumor board is tasked with refining the process for determining the stage and grade of these gynecologic malignancies to ensure optimal patient management. Which of the following approaches best aligns with current regulatory frameworks and best practices for staging and grading gynecologic cancers? Option A. Systematically applying the most current International Federation of Gynecology and Obstetrics (FIGO) staging system and the World Health Organization (WHO) histological grading system, ensuring all relevant pathological and radiological findings are integrated. Option B. Relying primarily on the surgeon's intraoperative estimation of tumor size and spread, supplemented by general clinical experience, without strict adherence to standardized staging criteria. Option C. Adjusting the FIGO stage and WHO grade downwards if the patient expresses a strong preference for less aggressive treatment, irrespective of the objective pathological findings. Option D. Utilizing a historical version of the FIGO staging system that was commonly used in the institution a decade ago, as it is familiar to the senior medical staff. The correct answer is A. Systematically applying the most current International Federation of Gynecology and Obstetrics (FIGO) staging system and the World Health Organization (WHO) histological grading system, ensuring all relevant pathological and radiological findings are integrated. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical importance of accurate staging and grading in gynecologic oncology. Misinterpretation or misapplication of staging and grading systems can lead to inappropriate treatment decisions, impacting patient outcomes, prognosis, and eligibility for clinical trials. The challenge lies in ensuring consistent and precise application of established guidelines in a complex clinical context, requiring a deep understanding of both the anatomical and pathological aspects of cancer progression. Correct approach analysis. The correct approach involves meticulously applying the most current International Federation of Gynecology and Obstetrics, FIGO staging system, and the World Health Organization, WHO, histological grading system. This represents best professional practice because these systems are internationally recognized, evidence-based, and regularly updated to reflect advancements in understanding and treatment. Adherence to these standardized systems ensures comparability of data, facilitates communication among healthcare professionals, and is essential for accurate prognostic assessment and treatment planning, aligning with ethical obligations to provide evidence-based care. Incorrect approaches analysis. One incorrect approach would be to rely solely on a physician's subjective assessment of tumor size and spread without systematically applying the FIGO criteria. This fails to meet regulatory and ethical standards by introducing significant variability and potential bias, undermining the objectivity required for accurate staging. It also disregards the established framework designed to ensure consistency and comparability of patient data. Another incorrect approach would be to use an outdated version of the FIGO staging system or the WHO grading system. This is a regulatory and ethical failure because it deviates from current best practices and evidence-based medicine. Outdated systems may not accurately reflect the latest understanding of disease progression or prognostic factors, leading to suboptimal treatment decisions and potentially harming patients. A third incorrect approach would be to prioritize patient preference for less aggressive treatment over accurate staging and grading, leading to a decision to downstage or undergrade the cancer. This is a profound ethical failure, as it compromises the physician's duty of care and the principle of beneficence by potentially withholding necessary treatment. It also violates regulatory requirements for accurate reporting and documentation of disease extent. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough review of all available diagnostic information, including imaging, surgical findings, and pathology reports. This information should then be meticulously cross-referenced with the current FIGO staging manual and the relevant WHO histological grading guidelines. Any ambiguities or discrepancies should be discussed with colleagues, including pathologists and radiologists, to ensure consensus. Documentation should clearly articulate the rationale for the assigned stage and grade, referencing the specific criteria used. Continuous professional development to stay abreast of updates to these staging and grading systems is also paramount. Question 12. The control framework reveals that a patient presents with a strong family history of ovarian and breast cancers, raising concerns about potential genetic predisposition. What is the most appropriate initial course of action for the gynecologic healthcare provider to ensure adherence to regulatory and ethical standards for patient care? Option A. Refer the patient directly to a genetic counselor without providing any preliminary information or assessment. Option B. Advise the patient that genetic testing is generally not recommended for individuals with a family history alone and suggest routine screening. Option C. Schedule a comprehensive pretest counseling session to discuss the patient's personal and family history, the implications of genetic testing, potential results, and available support services, followed by obtaining informed consent for testing if deemed appropriate. Option D. Immediately order genetic testing for common gynecologic cancer predisposition genes without further discussion. The correct answer is D. Immediately order genetic testing for common gynecologic cancer predisposition genes without further discussion. Explanation. Scenario analysis. This scenario presents a professional challenge due to the sensitive nature of genetic predisposition to gynecologic cancers. It requires a delicate balance between providing comprehensive information to the patient, respecting her autonomy, and adhering to established ethical and regulatory guidelines for genetic counseling and testing. The physician must navigate potential patient anxiety, the implications of genetic findings for family members, and the complexities of informed consent. Correct approach analysis. The correct approach emphasizes a thorough, patient-centered process that aligns with best practices in genetic counseling and aligns with regulatory expectations for patient care. This involves a detailed discussion of the patient's personal and family history, an explanation of the benefits and limitations of genetic testing, the potential implications of results, and the availability of genetic counseling services. Obtaining informed consent is paramount, ensuring the patient understands the procedure, its potential outcomes, and her right to refuse testing. This approach upholds patient autonomy, promotes informed decision-making, and adheres to ethical principles of beneficence and non-maleficence, as well as any relevant patient privacy regulations. Incorrect approaches analysis. One incorrect approach involves proceeding with genetic testing without a comprehensive discussion of its implications and without ensuring informed consent. This violates the ethical principle of patient autonomy and potentially regulatory requirements for informed consent in medical procedures. It can lead to a patient undergoing testing without fully understanding what it entails or the potential consequences of the results, causing undue distress or leading to decisions made without adequate information. Another incorrect approach is to dismiss the patient's concerns about genetic predisposition without adequate investigation or referral. This fails to uphold the physician's duty of care and can lead to missed opportunities for early detection or preventative measures. It also disregards the patient's expressed concerns, which is ethically problematic and can erode the patient-physician relationship. A third incorrect approach is to provide genetic testing results without adequate genetic counseling support. Genetic test results, particularly those indicating a predisposition to cancer, can be complex and emotionally challenging. Without proper counseling, patients may misinterpret results, experience significant anxiety, or fail to understand the recommended follow-up actions, thereby undermining the benefits of the testing. This can also be seen as a failure to provide comprehensive care as expected by regulatory bodies overseeing patient health services. Professional reasoning. Professionals should approach situations involving genetic predisposition and counseling by first conducting a thorough risk assessment based on personal and family history. This assessment should then inform a detailed discussion with the patient about the rationale for genetic testing, the specific genes being considered, the potential benefits, e.g., personalized screening, risk-reducing strategies, and limitations, e.g., possibility of inconclusive results, implications for family members, and the emotional and psychological impact of potential results. The process must culminate in obtaining explicit, informed consent, ensuring the patient has had ample opportunity to ask questions and understand all aspects of the testing. If testing is pursued, ensuring access to qualified genetic counseling services, both before and after testing, is crucial for interpreting results and developing an appropriate management plan. This systematic, patient-centered approach ensures compliance with ethical standards and regulatory requirements for patient care and autonomy. Question 13. Risk assessment procedures indicate a patient presence for her annual gynecologic examination. She is 48 years old, has no personal history of gynecologic cancers, and reports no family history of breast or ovarian cancer. Her last Pap smear was 3 years ago and was normal. She has no symptoms suggestive of gynecologic malignancy. Based on current evidence-based screening guidelines and best practices for gynecologic oncology, what is the most appropriate course of action regarding screening for cervical, ovarian, and uterine cancers for this patient? Option A. Recommend primary HPV testing for cervical cancer screening, initiate transvaginal ultrasound for ovarian cancer screening, and recommend annual endometrial biopsy for uterine cancer screening. Option B. Recommend a Pap smear with HPV co-testing for cervical cancer screening. Discuss the lack of routine screening recommendations for ovarian cancer in average-risk individuals, and defer uterine cancer screening as it is not indicated at this time. Option C. Recommend a Pap smear with HPV co-testing for cervical cancer screening. Recommend transvaginal ultrasound for ovarian cancer screening, and defer uterine cancer screening as it is not indicated at this time. Option D. Recommend a Pap smear with HPV co-testing for cervical cancer screening. Discuss the lack of routine screening recommendations for ovarian cancer in average-risk individuals, and initiate annual endometrial biopsy for uterine cancer screening. The correct answer is D. Recommend a Pap smear with HPV co-testing for cervical cancer screening. discuss the lack of routine screening recommendations for ovarian cancer in average-risk individuals, and initiate annual endometrial biopsy for uterine cancer screening. Explanation: scenario analysis. This scenario is professionally challenging because it requires a healthcare provider to navigate evolving screening guidelines for multiple gynecologic cancers, each with distinct risk factors, age recommendations, and screening modalities. The challenge lies in synthesizing this information to provide individualized, evidence-based recommendations that align with current best practices and patient values, while also considering potential patient anxieties and access to care. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized risk assessment. This involves not only understanding the general screening guidelines for cervical, ovarian, and uterine cancers, but also incorporating patient-specific factors such as family history, personal medical history, e.g., history of HPV infection, abnormal pap smears, polycystic ovary syndrome, endometriosis, obesity, nulliparity, and patient preferences. This aligns with the ethical principle of patient autonomy and beneficence, ensuring that screening decisions are tailored to maximize benefit and minimize harm for the individual. Adherence to current, evidence-based guidelines from reputable organizations, e.g., American College of Obstetricians and Gynecologists (ACOG), National Comprehensive Cancer Network (NCCN), if applicable to the specified jurisdiction, is paramount. Incorrect approach is analysis. One incorrect approach would be to solely rely on a patient's age to initiate or discontinue screening for all gynecologic cancers without considering other risk factors. This fails to acknowledge that screening guidelines are often risk stratified and that certain individuals may require earlier or more frequent screening, or conversely, may not benefit from screening at certain ages if they have no risk factors. This approach is ethically flawed as it can lead to underscreening of high-risk individuals or overscreening of low-risk individuals, potentially causing unnecessary anxiety, cost, and harm from false positives. Another incorrect approach would be to recommend ovarian cancer screening for all asymptomatic women, regardless of risk factors. Current guidelines generally do not recommend routine ovarian cancer screening for average-risk women due to a lack of proven mortality benefit and the potential for harm from false positives and invasive procedures. This approach would violate the principle of non-maleficence by exposing patients to unnecessary risks. A third incorrect approach would be to exclusively focus on cervical cancer screening via pap smears and neglect the importance of HPV testing, especially in jurisdictions where co-testing or primary HPV testing is recommended as part of the cervical cancer screening algorithm. This oversight can lead to suboptimal detection of precancerous lesions and an increased risk of cervical cancer. Professional reasoning. Professionals should adopt a systematic approach that begins with a thorough understanding of current, evidence-based screening guidelines for each gynecologic cancer. This should be followed by a detailed patient history to identify individual risk factors. Shared decision-making is crucial, where the provider educates the patient about the benefits, limitations, and risks of each screening option, allowing the patient to participate actively in the decision-making process. Regular review and updating of knowledge regarding guideline changes are essential for providing optimal care. Question 14. Governance review demonstrates a need to enhance the clinical team's understanding of menstrual cycle phase correlation with patient-reported symptoms. A patient presents with cyclical fatigue, breast tenderness, and mood changes that consistently worsen in the week preceding menstruation and resolve shortly after its onset. Based on the typical hormonal shifts and physiological events, which phase of the menstrual cycle is most likely associated with these reported symptoms? Option A, the follicular phase dominated by estrogen and leading up to ovulation. Option B, the ovulatory phase marked by the LH surge and estrogen peak. Option C, the luteal phase characterized by rising progesterone levels and a decline in estrogen prior to menstruation. Option D, the menstrual phase where hormone levels are at their lowest. The correct answer is C. The luteal phase, characterized by rising progesterone levels and a decline in estrogen prior to menstruation. Explanation. Scenario analysis. This scenario presents a professional challenge in interpreting and applying complex biological information within a clinical context. The challenge lies in accurately correlating patient-reported symptoms with the underlying physiological events of the menstrual cycle, particularly when symptoms might be atypical or overlap across phases. Misinterpretation can lead to incorrect diagnoses, inappropriate treatment plans, and a failure to address the patient's concerns effectively, impacting patient trust and outcomes. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's reported symptoms in conjunction with a thorough understanding of the hormonal and physiological changes characteristic of each menstrual cycle phase. This approach prioritizes evidence-based clinical reasoning, aligning patient presentation with established scientific knowledge of the follicular, ovulatory, and luteal phases. By considering the typical hormonal profiles, estrogen dominance in the follicular phase, LH surge for ovulation, progesterone dominance in the luteal phase, and their associated symptoms, e.g., premenstrual symptoms in the luteal phase, mid-cycle pain around ovulation, a clinician can accurately identify the most probable phase and address the patient's concerns with appropriate guidance and management. This aligns with professional ethical obligations to provide competent and evidence-based care. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's symptoms as normal variations without a detailed assessment of their timing relative to the menstrual cycle. This fails to acknowledge the potential for underlying pathology or the need for symptom management, violating the ethical duty of care and potentially leading to delayed diagnosis of conditions that may manifest with menstrual cycle irregularities. Another incorrect approach would be to solely rely on the patient's subjective description of symptoms, without attempting to correlate them with the objective biological events of the menstrual cycle. This overlooks the critical link between hormonal fluctuations and symptom presentation, leading to a superficial understanding of the patient's condition and potentially ineffective interventions. It represents a failure in clinical reasoning and diagnostic accuracy. A further incorrect approach would be to prematurely attribute symptoms to a specific phase without considering the full spectrum of possibilities or the potential for overlapping or atypical presentations. This demonstrates a lack of thoroughness and can lead to misdiagnosis and inappropriate treatment, failing to meet the standard of care expected in gynecologic practice. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and detailed symptom collection. This should be followed by a systematic review of the patient's menstrual history, including cycle length, regularity, and the timing and nature of reported symptoms. This information should then be critically analyzed against the known physiological events and hormonal profiles of the follicular, ovulatory, and luteal phases. If symptoms are unclear or suggest pathology, further diagnostic steps, such as hormonal assays or imaging, may be indicated. The framework emphasizes a patient-centered, evidence-based, and systematic approach to diagnosis and management. Question 15. The risk matrix shows a moderate likelihood of a patient presenting with chronic vulvar itching and discomfort, potentially indicative of lichen sclerosus or vulvodynia. Considering the potential for significant patient distress and the need for accurate diagnosis, which of the following diagnostic and management approaches best optimizes patient outcomes and adheres to professional standards? Option A. Conduct a comprehensive history and physical examination, including a detailed vulvar assessment, and consider further investigations such as a biopsy if indicated, followed by a tailored management plan. Option B. Immediately initiate empirical treatment for common vulvar infections based on the reported symptoms, without a detailed examination. Option C. Rely primarily on patient self-reporting of symptoms and suggest over-the-counter remedies, deferring a formal medical evaluation. Option D. Focus the consultation on psychological factors contributing to the discomfort, assuming the symptoms are psychosomatic in origin. The correct answer is A. Conduct a comprehensive history and physical examination, including a detailed vulvar assessment, and consider further investigations such as a biopsy if indicated, followed by a tailored management plan. Explanation. Scenario analysis. This scenario presents a professional challenge due to the subjective nature of vulvar and vaginal disorders, particularly lichen sclerosus and vulvodynia, and the potential for delayed diagnosis or misdiagnosis. Patients may experience significant distress and impact on quality of life, necessitating a thorough and empathetic approach. The challenge lies in balancing the need for timely and accurate diagnosis with the patient's comfort and the complexity of differential diagnoses. Correct approach analysis. The correct approach prioritizes a comprehensive diagnostic process that integrates patient history, physical examination, and appropriate investigations. This aligns with best professional practice by ensuring that all potential causes are considered and that the diagnosis is based on robust clinical evidence. In the context of gynecologic care, this approach upholds the ethical duty of care to provide accurate and effective treatment, minimizing patient suffering and preventing complications arising from untreated or misdiagnosed conditions. Regulatory frameworks typically mandate that healthcare professionals act within their scope of practice and adhere to established diagnostic standards. Incorrect approaches analysis. An approach that relies solely on a brief visual inspection, without a detailed history risks, overlooking crucial information that could point towards specific etiologies or contributing factors. This failure to gather comprehensive data is a breach of the duty of care and may lead to misdiagnosis, delaying appropriate management. Ethically, it demonstrates a lack of diligence and patient-centeredness. An approach that immediately prescribes empirical treatment without a definitive diagnosis, especially for chronic or complex conditions like lichen sclerosus or vulvodynia, can be problematic. While some conditions may respond to empirical treatment, this can mask underlying issues, lead to unnecessary side effects, or delay the identification of more serious conditions. This deviates from the principle of evidence-based practice and can be considered professionally negligent if not supported by clear clinical rationale and patient consent. An approach that dismisses the patient's symptoms as psychosomatic without a thorough physical and diagnostic workup is a significant ethical and professional failing. While psychological factors can influence pain perception, attributing symptoms solely to psychological causes without ruling out organic pathology is a form of diagnostic bias and can lead to patient distrust and inadequate care. This violates the principle of non-maleficence and can cause significant harm to the patient. Professional reasoning. Professionals should approach such cases by first establishing a strong rapport with the patient, encouraging open communication about their symptoms and concerns. A systematic diagnostic process should then be followed, starting with a detailed history, including onset, duration, character of symptoms, aggravating and alleviating factors, and impact on quality of life. This should be followed by a thorough physical examination, including a detailed vulvar and vaginal assessment. Based on these findings, appropriate investigations, such as biopsies for suspected lichen sclerosus or specific tests for infections, should be considered. The decision-making process should be guided by clinical guidelines, evidence-based medicine, and a commitment to patient safety and well-being. Regular review and reassessment are crucial, especially for chronic conditions. Question 16. The performance metrics show a slight increase in operative time for laparoscopic hysterectomies over the past quarter, alongside a stable complication rate. The department is considering several strategies to address this trend. Which of the following represents the most appropriate best practice approach? Option A. Immediately implement a new, faster surgical technique that has shown promising results in a single, small study published internationally, without further internal validation. Option B. Conduct a detailed review of individual surgical cases, including preoperative patient factors, intraoperative decision-making, and postoperative outcomes, to identify potential areas for efficiency improvement without compromising patient safety. Option C. Focus solely on reducing the average operative time by setting aggressive targets for all surgeons, assuming the stable complication rate indicates acceptable performance. Option D. Attribute the increase in operative time to the inherent complexity of laparoscopic procedures and maintain the current standard of care without further investigation. The correct answer is B. Conduct a detailed review of individual surgical cases, including preoperative patient factors, intraoperative decision-making, and postoperative outcomes, to identify potential areas for efficiency improvement without compromising patient safety. Explanation. This scenario presents a professional challenge due to the inherent variability in patient outcomes and the need to balance efficiency with the highest standard of care in gynecologic procedures. It requires careful judgment to interpret performance metrics and implement improvements without compromising patient safety or individual patient needs. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted review of performance data, incorporating direct clinical observation and feedback from the surgical team. This aligns with regulatory frameworks that mandate continuous quality improvement, evidence-based practice, and a commitment to patient safety. Specifically, it reflects the principles of quality assurance and risk management, ensuring that any identified deviations from expected outcomes are thoroughly investigated to determine root causes, which may include technical skill, equipment issues, or patient-specific factors. This systematic approach is crucial for identifying systemic issues and implementing targeted interventions, thereby enhancing overall patient care and outcomes in gynecologic procedures. An incorrect approach that focuses solely on reducing operative time without considering patient outcomes or complication rates is professionally unacceptable. This would represent a failure to adhere to the core ethical and regulatory obligation to prioritize patient well-being above all else. Such a focus could lead to rushed procedures, increased risk of complications, and ultimately poorer patient outcomes, violating principles of beneficence and non-maleficence. Another incorrect approach that involves implementing a new, unproven technique based on limited data from a single external source, without rigorous internal validation or peer review, is also professionally unacceptable. This disregards the regulatory requirement for evidence-based practice and could expose patients to unnecessary risks. It fails to demonstrate due diligence in evaluating new methodologies and could lead to adverse events, contravening the principles of responsible innovation and patient safety. A third incorrect approach that involves dismissing the observed variations as inherent to the complexity of gynecologic procedures without further investigation or action is professionally unacceptable. This demonstrates a lack of commitment to continuous quality improvement and a failure to proactively address potential risks. It neglects the regulatory expectation that healthcare providers actively monitor and improve their practice to ensure optimal patient care and minimize preventable harm. The professional decision-making process for similar situations should involve a structured approach to performance evaluation. This includes 1. Objective data analysis, reviewing all relevant performance metrics including patient outcomes, complication rates, and procedure times. 2. Clinical correlation, discussing the data with the surgical team to gain insights into the context of the procedures. 3. Root cause analysis. If deviations are identified, conducting a thorough investigation to determine the underlying causes. 4. Evidence-based intervention development, designing and implementing interventions based on evidence and best practices. 5. Monitoring and reevaluation, continuously tracking the impact of interventions and making adjustments as needed. This systematic process ensures that improvements are data-driven, clinically relevant, and ultimately beneficial to patient care. Question 17. Quality control measures reveal a case where a patient presenting with irregular menstrual cycles and hirsutism was diagnosed with polycystic ovary syndrome, PCOS. The management plan initiated focused solely on prescribing oral contraceptives to regulate menses and reduce androgenic symptoms, with no further investigation into insulin resistance or discussion of lifestyle modifications. Which of the following management approaches best aligns with current best practices for PCOS diagnosis and management? Option A. Immediately initiate metformin to improve insulin sensitivity and ovulation, without a comprehensive diagnostic workup for hyperandrogenism or consideration of other management strategies. Option B. Focus on managing the hirsutism with topical treatments and cosmetic interventions, while deferring management of menstrual irregularities and metabolic concerns. Option C. Prescribe oral contraceptives to regulate menstrual cycles and suppress androgenic symptoms, and advise the patient to return in 1 year for a follow-up appointment. Option D. Initiate lifestyle modifications including diet and exercise, conduct a thorough assessment for hyperandrogenism and ovulatory dysfunction, and consider pharmacotherapy based on specific symptom management and fertility goals, with regular monitoring for metabolic complications. The correct answer is D. Initiate lifestyle modifications including diet and exercise, conduct a thorough assessment for hyperandrogenism and ovulatory dysfunction, and consider pharmacotherapy based on specific symptom management and fertility goals, with regular monitoring for metabolic complications. Explanation. Scenario analysis. This scenario presents a common clinical challenge in managing polycystic ovary syndrome, PCOS, a complex endocrine disorder with significant reproductive and metabolic implications. The challenge lies in balancing the immediate need for symptom management with the long-term health risks associated with PCOS, such as insulin resistance and cardiovascular disease. Furthermore, the patient's desire for future fertility adds another layer of complexity, requiring a management plan that is both effective and fertility-sparing. The quality control measures highlight the importance of adhering to established diagnostic criteria and evidence-based management guidelines to ensure optimal patient outcomes and prevent potential harm. Correct approach analysis. The correct approach involves a comprehensive assessment that aligns with the Rotterdam criteria for PCOS diagnosis, which typically include 2 out of the following 3 features: oligo or anovulation, clinical or biochemical hyperandrogenism, and polycystic ovaries on ultrasound. Management should then be individualized, prioritizing lifestyle modifications, diet, and exercise as the cornerstone for improving insulin sensitivity and promoting weight management. Pharmacological interventions should be tailored to specific symptoms, such as hormonal contraceptives for menstrual regulation and hyperandrogenism, or metformin for insulin resistance and ovulation induction if fertility is desired. Regular monitoring for metabolic complications and cardiovascular risk factors is crucial. This approach is best professional practice because it is evidence-based, patient-centered, and adheres to current clinical guidelines, such as those from the National Institute for Health and Care Excellence, NICE, in the UK, which emphasize a holistic and stepwise management strategy. Incorrect approaches analysis. An approach that solely focuses on suppressing ovarian activity with hormonal contraceptives without addressing underlying metabolic dysfunction or considering the patient's fertility desires would be a regulatory and ethical failure. This overlooks the long-term health implications of PCOS and may not adequately manage all symptoms. It fails to meet the comprehensive diagnostic and management requirements expected in gynecologic care. An approach that immediately prescribes ovulation induction agents without a thorough diagnostic workup or lifestyle intervention would also be professionally unacceptable. This bypasses essential diagnostic steps and potentially exposes the patient to unnecessary medication risks without first optimizing her health through lifestyle changes, which are foundational in PCOS management. This deviates from best practice by not following a structured, evidence-based diagnostic and therapeutic pathway. An approach that dismisses the patient's concerns about hirsutism and acne as purely cosmetic, without investigating the underlying hyperandrogenism and its potential impact on her quality of life and overall health, is a failure to provide comprehensive care. This neglects a key diagnostic criterion for PCOS and demonstrates a lack of patient-centeredness, potentially leading to delayed or inadequate management of the condition. Professional reasoning. Professionals should employ a structured decision-making framework that begins with a thorough patient history and physical examination, followed by appropriate investigations to confirm the diagnosis of PCOS based on established criteria. This should be followed by a shared decision-making process with the patient, discussing the multifaceted nature of PCOS, its potential long-term health consequences, and the various management options available. The plan should be individualized, prioritizing lifestyle modifications, and then incorporating pharmacological or surgical interventions as needed, with ongoing monitoring and regular review. This systematic approach ensures that all aspects of the condition are addressed, patient autonomy is respected, and care is aligned with regulatory and ethical standards. Question 18. Assessment of a 28-year-old patient presenting with secondary amenorrhea for 6 months reveals significant patient distress regarding her fertility. She is eager for immediate intervention to restore her menstrual cycle. What is the most ethically and professionally sound approach to managing this patient's condition? Option A. Rely solely on the patient's self-reported symptoms and history to prescribe a treatment plan without further diagnostic testing. Option B. Initiate a comprehensive diagnostic workup to identify the underlying cause of amenorrhea before considering any treatment. Option C. Advise the patient that secondary amenorrhea is often self-limiting and suggest she wait a few more months before further investigation. Option D. Immediately prescribe a course of hormonal therapy to induce menstruation, as requested by the patient, to alleviate her distress. The correct answer is B. Initiate a comprehensive diagnostic workup to identify the underlying cause of amenorrhea before considering any treatment. Explanation. Scenario analysis. This scenario presents an ethical dilemma for a healthcare professional regarding a patient experiencing secondary amenorrhea. The challenge lies in balancing the patient's desire for a rapid diagnosis and treatment with the need for a thorough, evidence-based diagnostic workup. The patient's frustration and potential anxiety about her fertility add a layer of emotional complexity, requiring empathetic yet professionally sound decision-making. The professional must navigate the patient's expectations while adhering to established medical guidelines and ethical principles of patient care. Correct approach analysis. The correct approach prioritizes a comprehensive diagnostic evaluation before initiating treatment. This aligns with best professional practice by ensuring that the underlying cause of secondary amenorrhea is accurately identified. This approach respects the principle of beneficence, acting in the patient's best interest by avoiding premature or potentially ineffective interventions. It also upholds the principle of non-maleficence, do no harm, by not exposing the patient to unnecessary treatments or their associated risks. Furthermore, it adheres to professional standards of care, which mandate a systematic approach to diagnosis, particularly for conditions with potential long-term implications like reproductive health. This thoroughness also supports informed consent, as the patient can make decisions based on a clear understanding of her condition and the rationale for proposed treatments. Incorrect approaches analysis. One incorrect approach involves immediately prescribing hormonal therapy to induce menstruation without a complete diagnostic workup. This fails to identify the root cause of the amenorrhea, which could range from lifestyle factors to more serious underlying medical conditions, e.g., pituitary tumors, thyroid dysfunction, polycystic ovary syndrome. Prescribing hormones without diagnosis is potentially harmful, as it could mask a serious condition or lead to adverse effects from inappropriate hormonal manipulation. This approach violates the principle of non-maleficence and deviates from professional standards of care. Another incorrect approach is to dismiss the patient's concerns and delay further investigation, suggesting that amenorrhea is not a significant issue. This demonstrates a lack of empathy and disrespect for the patient's autonomy and concerns about her reproductive health. It fails to uphold the principle of respect for persons and can erode the patient-provider relationship. Ethically, healthcare professionals have a duty to investigate and address patient complaints, especially those related to reproductive health. A third incorrect approach is to rely solely on the patient's self-reported history without performing objective diagnostic tests. While patient history is crucial, it is often insufficient for a definitive diagnosis of amenorrhea. Objective tests such as blood work, hormone levels, imaging, ultrasound, and physical examinations are essential to rule out or confirm various etiologies. This approach risks misdiagnosis and inappropriate management, thereby failing to meet the standard of care and potentially causing harm. Professional reasoning. Professionals should approach such cases by first actively listening to and validating the patient's concerns. A detailed history should be taken, followed by a thorough physical examination. Based on this initial assessment, a stepwise diagnostic plan should be formulated, incorporating appropriate laboratory tests and imaging as indicated by clinical guidelines. The rationale for each step of the diagnostic process should be clearly explained to the patient, ensuring shared decision-making and informed consent. Treatment should only be initiated once a diagnosis is established, or a clear management plan for further investigation is agreed upon. This systematic and patient-centered approach ensures both ethical practice and effective medical care. Question 19. Comparative studies suggest that understanding the intricate interplay between the granulosa cells and theca cells within ovarian follicles is crucial for comprehending the hormonal milieu of the menstrual cycle. Considering this, which of the following best describes the primary functional consequence of theca cell activity in relation to granulosa cell function and subsequent estrogen synthesis? Option A. Granulosa cells synthesize androgen, which are then converted to estrogens by theca cells. Option B. Granulosa cells directly secrete progesterone, which stimulates theca cell proliferation. Option C. Theca cells produce androgens, which are then aromatized by granulosa cells into estrogens. Option D. Theca cells are responsible for producing luteinizing hormone, LH, which triggers ovulation. The correct answer is C. Theca cells produce androgens, which are then aromatized by granulosa cells into estrogens. Explanation. This scenario is professionally challenging because it requires a clinician to integrate complex anatomical and physiological knowledge with patient-specific factors to determine the most appropriate management strategy. The ovaries, as central components of the female reproductive system, have intricate structures and functions that directly impact fertility, hormonal balance, and overall health. Misunderstanding or misapplying knowledge about their structure and function can lead to suboptimal patient care, potentially resulting in misdiagnoses, inappropriate treatments, or unnecessary interventions. Careful judgment is required to balance the potential benefits and risks of different diagnostic and therapeutic pathways. The correct approach represents best professional practice because it prioritizes a thorough understanding of ovarian anatomy and physiology in the context of the patient's presenting symptoms and reproductive goals. This aligns with the fundamental ethical principle of beneficence, ensuring that patient care is guided by accurate scientific knowledge and tailored to individual needs. Adherence to established clinical guidelines and evidence-based medicine, which are implicitly expected within the gynecologic exam framework, further supports this approach. It emphasizes a systematic and informed decision-making process, leading to the most effective and safe management plan. An incorrect approach that focuses solely on superficial anatomical landmarks without considering the dynamic functional aspects of the ovaries would be professionally unacceptable. This would represent a failure to apply comprehensive knowledge, potentially leading to misinterpretation of findings and inappropriate diagnostic or therapeutic decisions. For instance, ignoring the role of ovarian follicles in hormone production or the cyclical changes within the ovary could lead to a failure to diagnose or manage conditions like polycystic ovary syndrome, PCOS, or premature ovarian insufficiency, POI, effectively. Another incorrect approach that relies on generalized assumptions about ovarian function without considering individual patient variations would also be ethically flawed. This could lead to a one-size-fits-all approach that fails to address the unique biological and clinical circumstances of the patient, violating the principle of individualized care. For example, assuming all ovarian cysts are benign without further investigation based on size, morphology, and patient symptoms would be a significant oversight. The professional reasoning process for similar situations should involve a systematic evaluation of the patient's history, physical examination findings, and relevant diagnostic tests. This should be followed by a comprehensive review of the current understanding of ovarian structure and function, including hormonal regulation, follicular development, ovulation, and the luteal phase. Clinicians must then synthesize this information to formulate a differential diagnosis and develop a management plan that is evidence-based, patient-centered, and ethically sound, always prioritizing the patient's well-being and informed consent. Question 20. Process analysis reveals that a patient presents with concerns regarding the hormonal regulation of her reproductive cycle, expressing a desire to optimize fertility and minimize premenstrual symptoms. She has a history of irregular cycles and has researched various hormonal interventions. What is the most appropriate initial approach for the healthcare provider to take? Option A. Advise the patient that her concerns are likely due to normal hormonal fluctuations and that no specific intervention is medically necessary at this time. Option B. Conduct a comprehensive assessment of the patient's reproductive history, lifestyle, current symptoms, and understanding of hormonal mechanisms, followed by a discussion of personalized, evidence-based treatment options and their potential impacts. Option C. Immediately prescribe a standard hormonal contraceptive regimen to regulate her cycle and address premenstrual symptoms, as this is a common and effective solution. Option D. Focus solely on explaining the complex endocrinology of the menstrual cycle without delving into her specific symptoms or personal reproductive goals. Correct answer is B. Conduct a comprehensive assessment of the patient's reproductive history, lifestyle, current symptoms, and understanding of hormonal mechanisms, followed by a discussion of personalized, evidence-based treatment options and their potential impacts. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare provider to navigate complex patient preferences, potential risks and benefits of treatment, and the nuanced hormonal regulation of reproduction, all within the framework of patient autonomy and informed consent. The provider must balance the patient's desire for a specific outcome with the medical realities and ethical considerations of hormonal interventions. Correct approach analysis. The correct approach emphasizes a thorough, individualized assessment of the patient's reproductive goals, medical history, and understanding of hormonal mechanisms. This aligns with best professional practice by prioritizing patient-centered care, ensuring informed consent, and tailoring treatment to the individual's unique physiological and psychological needs. It respects the patient's autonomy while ensuring medical safety and efficacy, adhering to ethical guidelines that mandate comprehensive counseling and shared decision-making. Incorrect approach is analysis. One incorrect approach involves immediately prescribing a hormonal regimen without a detailed discussion of the patient's reproductive history, lifestyle, and specific concerns. This fails to uphold the principle of informed consent, as the patient may not fully understand the implications or alternatives. It also neglects the individualized nature of hormonal regulation, potentially leading to suboptimal outcomes or adverse effects. Ethically, this approach bypasses the crucial step of patient education and shared decision-making. Another incorrect approach is to dismiss the patient's concerns about hormonal regulation due to a perceived lack of immediate medical necessity. This disregards the patient's subjective experience and their right to seek information and treatment related to their reproductive health. It can lead to patient dissatisfaction and a breakdown of trust, failing to address the holistic needs of the patient. A further incorrect approach might involve focusing solely on the physiological aspects of hormonal regulation without adequately exploring the patient's psychosocial context and reproductive aspirations. While understanding the endocrine system is vital, ignoring the patient's life goals and emotional well-being can result in a treatment plan that is medically sound but not personally appropriate or sustainable for the patient. This represents a failure to provide comprehensive, holistic care. Professional reasoning. Professionals should adopt a systematic approach that begins with active listening and empathetic engagement with the patient. This involves gathering a detailed medical and reproductive history, assessing the patient's understanding of their condition and treatment options, and clearly explaining the physiological mechanisms of hormonal regulation relevant to their situation. The provider must then collaboratively develop a treatment plan that aligns with the patient's goals, values, and medical profile, ensuring all risks, benefits, and alternatives are thoroughly discussed. This process fosters trust, promotes adherence, and upholds the highest ethical standards of patient care.